talking about the decades of experience that you have and how confident I am that, you are definitely one of the best, in Nigeria.
Okay. I think I just really do what I need to do, that's all.
Absolutely, absolutely. Thank you very much for your time today. I know we just have about an hour with you, so I'm going to get right into it. Now, we've had a lot of women that have had miscarriages. A lot of them significantly have these miscarriages in the first trimester, although I'm going to get to some of the questions that we have for second and third trimester, but a lot of them have this in the first trimester. What would you say are like the common causes, and more importantly, what should women take note of, especially first trimester moms, to reduce the chances of them having a miscarriage?
Um, okay, well, the first thing is good morning, everybody, irrespective of where you are, good morning. I think it's a very lovely day, where I am, very nice weather. I wish I can actually show you the weather is so nice.
Wow.
Um, okay, so getting to, so my name is Juwon Alabi, Ola Juwon Alabi. I'm a gynecologist and I work in Lagos at South Shore Women's and Children's Hospital. I also work in a fertility clinic attached to South Shore as well, called Bloom Fertility Clinic. I graduated from medical school donkeys years ago. That's 1994. And then I started my first gynecology job in 1998. So I think you can say that when you say you have donkey years of experience, well, yeah. So from 1998 up to date. So started practicing in Nigeria in 2020, 2010, 2011, started South Shore in 2012. So there we go. Right. So a lot of the clients I see probably come with a lot of things like discharge, bleeding, miscarriage. But the topic we're describing today, or we're talking about today, is miscarriage. I think the first thing is that a lot of miscarriage, we can't really, um, it is very difficult to know why miscarriage happened. There are reasons why it happens, but it's almost as if it, it does happen, and sometimes we're not able to find the reason why it happens. Yes, miscarriage can be first trimester, it can be second trimester. First trimester is anything from when you got pregnant. Some people will say to 12 weeks, some people will say 14 weeks, whatever. I think the acceptable is 12 weeks. So if you're 12 plus 5, 6, it's still it's still first trimester. Second trimester is from 12 weeks to now, that's a bit tricky because in a place like America, England, miscarriage is up to like when the baby is viable, which is 24 weeks. And now it's even different, it's changing because there have been reported cases of some babies surviving at 23 weeks. But in places like Nigeria, where sometimes people can still classify miscarriage up to like 28 weeks, although things are getting better now. Babies in Nigeria usually survive at 26 weeks now. Hopefully, we will keep on coming down to like 24 weeks. So it just means that pregnancy loss at a particular time. Now, like I said, first trimester, there are lots of reasons why it can happen. For example, I'm sorry, majority of miscarriage in first trimester, we don't know why it happens, is one of those things. But there are some conditions that predisposes people to miscarriage. For example, if you have diabetes or you have a chronic medical condition, diabetes, hypertension, kidney disease, all those things, they can, because your body is not necessarily in the right place, so miscarriage can happen. So the advice we usually give people like that is before you get pregnant, go and see your doctor so that they can manage your condition, so that your body is at optimum before you get or attempt to start trying to get pregnant. If that is done, then your pregnancy chances are not different from anybody that doesn't have that condition. So, I mean, obviously that's called pre-pregnancy planning. You want to plan things before you get pregnant. And to be honest, it's not only for people that have medical condition. If you're intentional about getting pregnant, you can see your doctor before and say, okay, can you please check me, make sure my body is fine before I get pregnant, before I start trying. Because what you don't want to do is you don't want them to find a condition that's there when you're pregnant, and then it's too late to rectify it. So yeah, medical issue. Sometimes also, what actually makes pregnancy? What makes pregnancy is sperm, egg from the woman, and then when they combine, they go into the womb, and then so the house, which is the womb. So let's start with the sperm. Um, for some reason, some people generate a lot of abnormal sperm cells, whether they are chronic drinkers, whether they are chronic smokers, whether they have medical issue, whether they are on medication that are deadly to the sperm. It means that all the sperm they produce or most of the sperm they produce are not matured, or they're not strong sperm, or they have problems, they've been damaged one way or the other. So it means that when they fertilize the egg, yes, they can fertilize the egg and the person gets pregnant, but the pregnancy itself is not a normal pregnancy because the sperm is abnormal. So it means that there's a problem with the formation of that pregnancy in the first place. So obviously that leads to miscarriage. Now, the problem with that is that once a pregnancy is formed, it's very difficult to determine that. And again, it will be a bit aggressive as well. And I would not recommend it. I'm not recommending that once you get married, you want to go and check your husband's sperm. No, I'm not recommending that. But I'm recommending that if a miscarriage happened maybe twice or three times, it's something to go and look into, unfortunately. I don't think you should say, oh, I want to marry you. Let's go and check your sperm and make sure your sperm is okay now. So because that is very uncommon. The next one is eggs. Um, one of the problem with eggs is that, and this is, as you grow older, the DNA and the quality of your egg reduces, and the DNA, they go into something called DNA injury, like fragmentation. They start becoming unstable and stuff like that. So that's why miscarriage is commoner as you grow older, especially towards your 40s or late 30s and early 40s. So same thing, normal sperm, abnormal egg, the join, a pregnancy form, but the pregnancy is not going to stay because one element is almost like saying that you need 50% from here, you need 50% from here, but you can only get 50 and maybe 20. So that's incomplete. So yes, a pregnancy will be formed, but the quality or the content inside the pregnancy is not real. And that's why I don't know whether some people have heard miscarriage or empty sac when there's nothing inside the sac.
Yes, that
It's
was going to lead to my next question exactly.
yeah. So those are the situation where yes, the components meet, but one of them is not complete. So they form a pregnancy, but there are lots of things missing in that pregnancy. Unfortunately, your body still, that sac is still expanding. So your body is still thinking that, yeah, this pregnancy is going to go on. But at some point, your body will realize that, okay, nah, this is not going to work. I mean, I'm sorry to say it again, but you can equate to you're driving somewhere and then you're going, unfortunately, you didn't use your Google map. And suddenly you realize that, oh, have I missed my way? And you start turning back or you stop. So it's almost like that with the pregnancy as well. Just realize that, no, I'm not complete. I left a part somewhere. So, and then the pregnancy stop, and then the woman start either bleeding or doesn't feel pregnant again, or she has a scan and doctor is advising her that, oh, this pregnancy is not going to go anywhere.
I
Now,
wanted
last,
to. I'm sorry, doctor. Sorry, I mean, just as you mentioned, talk about gestational sac. I wanted to quickly paint a few scenarios and just really
Okay.
get your thoughts of what we have seen. Now, the first scenario we have seen is moms coming to us, and the scan is showing that the gestational sac is empty. For a woman that is having that situation, what would you recommend that she should do? Should she stay hopeful that something can happen, or just let nature take its course?
Um, okay. So you have to be careful about that because it depends on now. So the first thing is that the person needs to be sure about their pregnancy age because it is acceptable for the sac to be empty at some point, maybe less than 5 weeks, depending on what kind of scan you're using. There's a different because when you're in Nigeria, you see different quality of scans. You see the good ones, extremely good ones, and you see the low quality ones. Now, if you were scanned at about 5 weeks and they can't see anything, I would tell you that maybe just say, wait, let me come back in another week or two. Let's see whether something will happen. Now, if you are definitely sure about your pregnancy age and you are about 7 weeks and there's nothing in, it's unlikely that it's almost impossible that anything will grow in it. Now, a lot of, oh, let's wait and see, it's almost to satisfy your conscience or to satisfy you that, nah, this is not going to change because what you don't want to do is somebody tells you that there's nothing in this pregnancy. Immediately, you want to have a DNC, and then 2 years later, you're thinking, I wish I had waited. How did I know that that pregnancy wouldn't grow? So it's almost like you want to satisfy yourself by giving your body chance. Now, that is not dangerous. I mean, emotionally, you're stressed because you're thinking, what happens to this pregnancy and stuff like that. But a lot of the time, there's nothing wrong in waiting for about a week or more and getting another scan, maybe even a second opinion somewhere else. So I don't know
Okay.
whether that answers your
Yes,
question.
that was a very good response. Thank you. So I'm going to paint the
Yeah,
next scenario that another common scenario would be that there's no fetal pool. A
yeah.
woman goes ahead to do a scan at say 7 weeks, and she's realizing that there's no fetal pool. Is this something to be worried? At what point should she be worried, and what would you
Well,
recommend?
it's the same. No fetal poles means empty sac, really, because the fetal pole is the baby. So if they say no fetal pole, it means that there's nothing inside the sac. Now, it's the same discussion from the one we had previously, which is the sac is empty. Now, you might have a fetal pole, but the fetal pole is not changing. That's another thing. It means that the pregnancy has stopped growing. A lot of these things you can't really determine. And unfortunately, one of the things is that now I know, so there are guidelines to managing miscarriages. And the advice is that in a young woman, it doesn't, it's the advice, like a body, like the ups and gynae body, the miscarriage body, the advice that we should not investigate a miscarriage until they've had at least three. The reason being that 90% of miscarriage, you will not find anything. Now, having said that, it's also up to the individual. Maybe, for example, if you have one miscarriage and you feel, you know what, I can't afford to have a second one, then you can decide to go and investigate yourself because every situation is different. I mean, if I'm 36 years old, I've been married for 5 years, and I've been trying to conceive, and then now I got pregnant, and then I have a miscarriage. Obviously, I'll be concerned because it's almost as if, oh, I had a chance, and this chance was taken away from me. So I want to go and investigate it so that next one, at least I know. I won't want to wait for a second, third miscarriage before I start investigating whether there's a reason there or not. So I think though, so absence fetal pole means that there's no baby inside the sac. It's the same. Now, I think let me just quickly conclude on the third part, which is the physical, okay, the house where the baby stays. And that's one of the major challenge in Nigeria, really. Now, you have a house which is meant to carry a pregnancy, but you have occupiers in the house. Occupiers can be fibroid. Fibroid is it comes and stay there and chases everybody away and like, no, don't come here. Fibroid is a occupier. Now, we also have something called intrauterine additions. Oh, some people, the bad ones are called Ashermans, the mild ones are called intrauterine addition. How does the addition form? Unfortunately, a lot of people, when they are younger, they had a pregnancy and then they had it terminated. And when they get it terminated, unfortunately, still bothers down to the fact that termination is not acceptable really in Nigeria. So a lot of people have their termination done either back road or somebody who's not certified to do it and stuff like that. So they have a lot of injury inside the womb, scar tissue. I mean, the way I explain it to people is just imagine a football field. So what a pregnancy is meant to come and do is it's almost like a ball and it's meant to come on a football field. And that football field should be luscious, should be like nicely done, green and everything. And the ball is just meant to land on it like that and start settling. But on that field, with somebody that had injuries on it, so just imagine some part of the field has been um, a caterpillar or whatever has come and then pulled away some of the grass. So you'll just have like bare land in a lot of places. So the pregnancy comes and it can't attach because there's no green to attach to. I mean, I'm just trying to create that picture so that you understand that. So now you don't know that because the inside of the womb, you can't see it. But the pregnancy, you just notice that basically the sperm and egg meets, but it's not attaching. And you wouldn't know that because you wouldn't miss your period. You will just realize that you're not getting pregnant, you're not getting pregnant. So those are the reason as well. So that if somebody is struggling either to get pregnant or have miscarriages, it's important to get involved with their doctor so that they can. I mean, what I will do in that scenario is put a camera inside the womb, something called hysteroscopy, look inside and make sure that everything is sealed. For the fibroid, not all fibroid causes miscarriage. You can have 20 different people and their fibroid affect them differently. And it's not the size, really, it's the position of the fibroid. If you have a fibroid staying where the pregnancy is meant to stay, people will either not get pregnant or have a miscarriage. If you have a fibroid just pushing into the wall of the womb, so the fibroids are hard, they're hard structures. And this pregnancy is trying to attach because, I mean, the way that I also address that is if you think about, the sowing of the seed in the Bible where somebody threw their seed on a hard rock. It's similar because it won't grow because there's a hard rock. It's meant to be soft, it's meant to be succulent, but it's not, So, but like I said, not all fibroid. A lot of people get pregnant with fibroid and it doesn't affect them that way. So those are the main reason why people, those are the main reason people have miscarriages. I don't
Thank
know
you.
whether that covers that. Yeah.
Yes, yes. So I'm going to go back again to the scenarios. A major issue that we've also noticed with a lot of moms in first trimester, is also the issue of spotting, bleeding.
Mm.
What level of spotting and bleeding should concern a mom?
Every level of bleeding and spotting should concern a mom. If you bleed or spot, you should get yourself checked. Having said that, 95% or 99% of time, the bleeding will stop. All right. So bleeding sometimes happen. It might be that the pregnancy, so the attachment of the pregnancy to the womb, a little bit of detachment happens. So you bled, but it will seal by itself. In most part of the world, they will leave you alone. In Nigeria, I know there's a high tendency to want to do something because or a lot of it's just like even if you don't give that person a medication, they probably will be fine. So, but there's a tendency that I'm going to say this, and I don't mean it in a bad way. When a patient comes to a doctor and the doctor doesn't give any medication, sometimes patients sometimes make doctors feel as if they're not doing anything. So I think the tendency in Nigeria to want to give a medication is very high. The most common medication that they use in Nigeria is a medication called progesterone. So whether it's dofaston, whether it's cyclogest, a lot of people use it. Now, not everybody that you give cyclogest or dofaston needs it. But Nigeria, it's almost like you give it believing that, oh, if they need it, their body will take it. If they don't need it, their body will get it. Now, in some other countries where either the insurance is paying or in NHS, because cost is a big issue there. If you don't need a medication, you don't get it. So a lot of people will not get progesterone because they don't need it. I mean, to be honest, you can measure progesterone level in people as well and see whether they need it or not. And if they don't need it, I mean, it takes about 24 hours for the result to come out. Now, but that is different. If you're also, apart from the spotting, if you're having some cramps, then yes, progesterone can help because progesterone helps to keep the womb relaxed, quiet. So I tend to use it if the person is having cramps, not necessarily to stop the miscarriage, but just to relax the womb so that the womb doesn't keep contracting and then leads to a miscarriage. I don't know whether
Thank you.
is that yeah.
Yes. Another question for first trimester, just before I get into second trimester, some of the common scenarios that we've seen, is the case of foods. I think it's even all through pregnancy, and I know that a lot of gynecologists are very I mean, there's no direct response, but a lot of moms say, they said I should not eat this. They said I should not eat this. This can cause, and I think this is more of a Nigerian and an African thing. They said this can cause a miscarriage if I eat this. If I think it was when I ate pineapple that I had a miscarriage. What are your thoughts? Especially Dr. Labi, with your decades of experience, it would really be nice to hear what you have to say.
I think, to be honest, I don't know any food that causes miscarriage. So that's the bottom line. I honestly don't know any food that causes that. But I think a lot of this is, there are a lot of myths around in Nigeria. There's a lot of misconception. There's a lot of, there's a lot of wrong statements flying all over. Personally, I do not. I mean, there was a time I was hearing that Zobo was causing miscarriage. I don't know whether you heard that.
Yes.
Yes. No, I honestly I don't know where the research came from. I don't now. There's a lot of misconception in it. So in terms of food, I'm not sure that there's any food that causes miscarriages. Now, a lot of our African food doesn't. Now, if you go outside Nigeria, then there are a lot of food that can affect pregnancy, not causes miscarriage, that can cause, but those are like some funny cheese, some funny, so things like that. But particularly for our part of the world, there's no food that I can suggest like causes miscarriage.
Thank you for that. And I think for us, Abimigo, what we've sort of looked at as the verdict for that would be that any food that a mom feels, I mean, there's no danger in not eating
Absolutely.
a particular food.
Absolutely.
So,
If you feel that you want to stay away from one particular food, then it's up to you to do that.
yeah.
Yeah, so that's more psychological rather than anything. So I think do what pleases you. But just make sure that you're not depriving yourself of the content of that food because you're not taking it. So maybe use pregnant care or multivitamins to compensate for that.
Thank you. I'll then move to second trimester and some of the common scenarios that we've seen. A common scenario we've seen for miscarriages in second trimester would be a mom suddenly seeing that she has experienced water break, and many times the amniotic fluid content is low. They are saying is inadequate. what would you recommend for women that find themselves in this situation? And is there also any way to prevent the amniotic fluid from becoming inadequate?
Okay, so the first thing is, so is that, are we talking about second trimester now?
Yes, yeah. I mean, because from our own work, we noticed that this happened a lot in the second
Yeah,
trimester.
yeah. So the first thing is that, so the causes of miscarriage in the second trimester is different from the first trimester. The second semester in Nigeria, the commonest the commonest cause of miscarriage or the situation you describe is incompetent cervix. So now incompetent cervix means that you have a womb. So you have the body of the womb and then you have the cervix. The cervix is the one that is almost like the door to the womb and is meant to be shut. Yes, sperm can go through it, but baby should not be able to come out until you're about to deliver. Now, as the weight of the baby increases, especially in the second trimester means between 12 weeks to 24 weeks. But most of these events start happening about 17, 18 weeks. Now, the pressure of the baby, the weight of the baby start impacting on the cervix, and then the cervix start opening. When the cervix opens, the first thing that comes out is the bag, because remember, there's a bag around the baby. So the bag forms almost like a hourglass appearance. And then once it comes out, at some point, there's a pressure on it, and then it bursts. And when it bursts that way, it means, to be honest, that's the end of the pregnancy, really. So let me come back to why does the cervix do that? Now, a lot of the time, people have had an injury to their cervix, especially when they have had a D&C, because one of the things with D&C is that, okay, so the deep parts, you want to dilate the cervix. And unfortunately, a lot of people just force the cervix to dilate when they go and do D&C, they force it. Now, there are ways for if a D&C is done within a hospital setting, there are ways to do it. You give the person medication. The medication softens the cervix and allows you to dilate it easily without injuring it, so that you can get to inside the womb. Now, once the cervix is injured, it means that it's almost as if the door is dysfunctional. So anything that stays in there, it will fall out. So in situation like that, the only thing you can do is if the person gets pregnant, you want to go and put something called a cervical sacklage a lot early. So a sacklage is like you want to wrap something around the door so that the cervix doesn't open. So it can be done either vaginally or laparoscopically or abdominally, depending on the complexity of the miscarriage or the person. But the simple one is to put like a support structure around the cervix. Now, when the water breaks, so the water around the baby is mainly made by the baby. Means that it's urine. The baby produces it, drinks it. Now, it's not scary because it's not at that time, it's not urine. Okay, it's just like water. So that's why they can drink it and pee it and drink it, because it's pure. It's not like the urine that you and I pass. It's pure, normal, almost like salt water. So now, but it's meant to circulate. So there's a pool, they drink it, they pee it, they drink. So they're maintaining that. And the placenta and everything is still producing some of it as well. The problem is that once it leaks out, two things happen. The first one is the bag around the bag of the water is a defense mechanism to prevent infection. So as the bag has busted or leaks or infection from the vagina, which are normal organisms that are meant, so the vagina has organisms that they're not dangerous, but when they come into situation like this, they can cause an infection. So the bacteria goes inside the bag and start causing an infection, and then the woman start having pain, funny discharge, and then they start contracting, or the doctor advised them that, oh, this infection is dangerous, we need to get rid of the baby. That's why if you have a miscarriage, or if your water goes about 18, 19 weeks, the chances, it's almost like zero chance for that baby to survive. The reason being that infection sets in, the water is also needed. The water is needed for the lungs of the baby to mature. So if there's no water, you might end up having a baby. Let's say it happens at 21 weeks and you want to get to 28 weeks. You might end up having a baby preterm whose lung is not matured and will need oxygen for the rest of their life. So those are things that, doctors sometimes have to consider in making decisions about, okay, what should we do? Should we offer this person? This pregnancy is not going to go anywhere. I think I would advise you to terminate it at this time. And the person is very emotional about it because they want to give it as much chance as possible, believing that, oh, can we not just carry on? The water can reform and stuff like that. Very rarely, extremely, I mean, I know that there are situations very rarely that maybe the water forms again and the area that ruptures close, but those are maybe 1 in a million. It doesn't happen routinely like that. So I think the main thing is that if you're in your second trimester and your water breaks, remember that that's most likely a weak cervix. Next time, make sure that you get a cerclage in your next pregnancy.
Well, thank you. That was very
yeah, but I haven't said that. It's not only cerclage, it's not only weak cervix that causes miscarriage in second trimester. So second trimester is very different from first trimester. With second trimester, when a miscarriage happens, you will have to investigate it because it's not meant to happen. So you will look at infection, viral infection, like there's something called touch screen, toxoplasma, rubella, CMV, hepatitis, herpes. You want to do a lot of screening with that. Even gonorrhea, chlamydia, you want to do that. You want to check for diabetes, you want to check for thyroid to see whether, so you will do a barrage of tests, and then you do something called antiphospholipids. So antiphospholipid is your body sometimes produces some antibodies, and those antibodies can attack pregnancy. So you want to, and why does that happen? Sometimes, if you look at it, some people diabetes is caused because their body attacked their pancreas. Some people arthritis is caused because their body develop antibodies that attacks their joints. It's the same with pregnancy as well. Your body can develop some antibodies that can go and start fighting pregnancy when you have it. So the whole idea is that once you run all that test, then you pick the one that is useful, or the one, most of the time, same. All the tests can come out negative, saying there's no issue. But sometimes you can pick things that you can address as well. Like I said, first trimester miscarriage is very different from second trimester. Second trimester must always be investigated. First trimester, maybe one, and the person is young. You might say, well, not necessarily. But with the second trimester, you have to investigate it. All right?
Thank you. We're going to start taking questions. I can see questions already in the chat box. Mamas, you can start dropping your questions. But I'm going to ask Dr. Abel 1 or 2 more questions, and then we can take your questions. Another thing that we've seen a lot would be mamas treating certain conditions in pregnancy. I was wondering if you could just highlight some conditions that if left untreated in pregnancy. So of course we've had common ones like infection, we've had cases of malaria. These things, if left untreated, do we have any chances of these things leading to a miscarriage?
Absolutely. I think malaria, like you said, in our society, malaria is very common. If you have severe malaria, it can definitely cause miscarriage, because remember that thing. So severe malaria to your body will be like a very stressful condition, and stress itself can make you lose a pregnancy. Severe stress, Not, I mean, everybody goes through some kind of stress in Nigeria anyway, but we're talking about severe stress. It can lead to, so things like every condition can lead to a miscarriage if it's not treated. Diabetes, high blood pressure, kidney problem, lungs problem, heart problem. Now, I want to believe that before you even start, if you have a heart problem or diabetes, you must be working with your doctor to ensure that everything is sorted out or stable before you attempt to have pregnancy. Something like sarcoidosis, SLE, systemic lupus erythematosus, which is common in Black people, hepatitis, yeah, all that. If somebody has it, the main caveat is if not managed properly, okay? If it's not managed properly, it can lead to miscarriage. That's the main thing. Even HIV, if not managed properly, can lead to miscarriage. Having said that, a lot of people that are managed as HIV, I mean, we have managed a lot of people with HIV, and their babies are not affected in any way. Their baby does not have HIV. So yeah.
Okay, thank you for that. My final question, and then I can see the questions already in the chat box, would be cases of the baby suddenly, that's in quote, suddenly stops breathing, and a woman has carried her baby for 8 months, third trimester, even bought baby items. They're just counting down, and all of a sudden she doesn't feel baby's movements for 48 hours, 72 hours, and the baby is gone, baby loss.
Yeah.
What can a woman do to, I would say, prevent? Because a lot of moms are quite keen on prevention. And just really, what are your thoughts on this?
Well, so the first thing is that remember that we cannot, so there's no process that monitors the baby 24 hours, 7 days a week and stuff like that. There's no process with that. So yeah, I mean, let me give you an example. Let me give you two scenarios. A few years ago, one of my late wife's friend, she was based in London. She did all her antenatal care, everything fine, but she wanted to have an American baby, so she flew to America. And then she got to America, she was receiving antenatal, and then she just called us one day that, guess what? They said the baby has died, and I think she was about 38 weeks. Right. She did everything that she was meant to do, but it still happened. Now, the second one is a lady that I looked after in Lagos. I think she was 40 something years old, had IVF, pregnancy. And because that pregnancy was so precious to her, immediately she was 21 weeks, she flew to America and stayed in America. But I just got a phone call one day. She called Dr. Labi, the baby has died. And I was like, wow, what happened? The day she was meant to have an elective cesarean, they couldn't find the heartbeat again. Now, I'm not saying this to scare people or anything like that. The problem with it is that a lot of the time we don't know why it happens. So that is why the advice is you have to be careful about your baby's movement, because I mean some of them is sudden. I remember one as well who was somebody I managed in Lagos as well. She was about to travel to somewhere to deliver, and then she just came in and said, I couldn't feel the baby. And when we induced her, we saw that the cord, the baby has knotted the cord. So there's no blood flow from the placenta to the baby. So now, how do you prevent that? You can't prevent that. Is almost saying that you want to prevent all the accidents to happen in this world. Unfortunately, we know we can't do that. But what we can do is highlight the advantage or the awareness that you have to always keep in mind a change in your baby's behavior. That's the only, which is called reduced movement. Now, your reduced baby's movement must not be taken lightly. If you feel that your baby is not moving the way, okay, so let me roll back a bit as well. when you're in your third trimester, somebody would have been monitoring your baby, will know that the baby is normal size, small size, or big size. So the small size baby are the tricky one because it means that small stress that gets to them, they can react to it. So that's why they get a lot of scans and a lot of monitoring small babies. And then once you see that they've gotten to a point where you think, this baby is small, you don't know what can happen next, then you might want to either deliver that baby or induce them or do a cesarean. Obviously, that's why there must be a very strong relationship between the person that's looking after you as a doctor and yourself as well. I don't mean calling them all the time, but you must trust them and you must be able to relay information to them when you need to. Now, the second one is the ones that are normal size, and those are the tricky ones because this baby is normal size. You don't need to be scanning them all the time, so they're normal size. So if they're normal size, why at some point do their movement reduce or they stop breathing? And that's a tricky one. Nobody can answer that in this world because it still happens. But what we can do is when somebody start coming to the hospital that I don't feel this baby move as much, then it means that there's a warning sign there, and you might want to speak with the parents and say, okay, we're going to monitor you more. Look at the baby's water, the water around the baby. Look at the blood supply, something called Dopplers. Any baby that's going to run into trouble sometimes give you salient signs, give you like simple signs. But if you miss those signs, then it leads to problem. So those are the kind of situations. So, but despite it, it's extremely unlikely that a baby that is monitored properly, not properly, monitored all the time will have a situation like that. Very unlikely. Now, the tricky ones are, oh, your baby is growing well, everything is fine, see you in 2 weeks. The question is that how do we know that nothing can happen within the 2 weeks? So the onus now falls on the mom. Please monitor your baby's movement. It's not a count. You can't count. It's a pattern. Nobody will tell you. I mean, a few years ago, you say, it must be 10 a day. No, it's not a 10 a day. It's a pattern. Some babies like moving in the morning. Some like moving in the afternoon. Some like moving in the evening. If your baby is not following the pattern that you're known him or her to, don't wait till the next day before you tell a doctor. Don't wait. Drive yourself to a hospital and say, please monitor my baby. Make sure my baby is fine. Okay? So that's the way I will answer that.
Wow, that was very insightful. And I think there's been some conversations, on women also having the fetal Doppler that they can use to check the heartbeat.
No.
What do you think?
No, I wouldn't recommend that.
Hmm.
I think that it creates a lot of anxiety. Because you don't know. For example, you might place the monitor on a place where the baby has moved away from that. I think you will just be giving yourself unnecessary anxiety. Just work with a facility that you trust, that you can go in and have a monitor. You can, you can call them and say, I'm coming to have my baby monitored. The worst case scenario is that you will pay for it, Abby. But at least it will reassure you that everything is fine. That's the main thing.
Yeah, thank you for that. Let me get into the questions in the chat box. Wow. Okay, so I think so. The last question will be the last question because I know Labi also needs to run soon. So I'm gonna start. So a woman says, Makalejaye says, I got pregnant some time ago, and after 5 weeks, I noticed that there's no pregnancy symptoms again. Went to see my gynae and requested for scan, and it was then that we were told that there is sac, but no fetal pole. But my fibroid got bigger than expected. She says, do we have any suggestion on what happened?
It might be, so fibroids are, so now, like I was explaining in the first trimester miscarriage, that fibroids are, they can be there and has no impact on your pregnancy whatsoever. The fact that they're getting bigger doesn't mean that the fibroid impacted on the pregnancy at all. It's just, from my explanation, if the pregnancy stopped growing or there's no fetal pole, it just means that the pregnancy, the manufacturing of it in the first place was defected. So it's never going to go anywhere. Now, let me just quickly come in as well. fibroid can cause second trimester miscarriages as well, because sometimes they cause severe pain, especially people that have a lot of it. And then once they do that, they start causing like cramps on the womb, and they can make the woman expel the baby. So now you won't know that because, nobody can advise you on the impact of a fibroid on your pregnancy. Sometimes you advise people to, I think this pregnancy, your fibroid can affect you, remove the pregnancy, remove the fibroid, but they come back into the facility pregnant. Sometimes some of them will get through the pregnancy, but sometimes some of them will have miscarriages. And then, I mean, whether you like it or not, although you give somebody information, but it's still up to them to accept it or not. What you can do at that time is support them, but go back to the original discussion that, you know what, yeah, let's sort this out. But before you attempt another one, at least we know that these fibroids affect you. Let's remove it before you move forward any longer. Yeah.
All right. So the next question says, can ulcer cause miscarriages or lead to it?
No, unless it's severe, unless you have a normal day ulcer should not, it doesn't cause miscarriage,
Okay. So another person says, what is the disadvantage of having excess amniotic fluid?
Okay, that's very interesting because I still saw somebody in the clinic yesterday who so amniotic fluid is the fluid around the baby, and it's produced, like I said, it's produced either by the baby or the placenta. And let's say it's meant to be 5. No, let's say it's meant to be between 3 and 7. Some people will have 3, some people will have 7, some people will have 2, some people might have 10 because their body is overproducing. So when they're overproducing, there's some certain conditions that lead to overproduction, which is diabetes. So with that, so if somebody comes to me and their water is excessive, I want to check them for something called gestational diabetes in pregnancy. I also want to make sure that they have not got a infection, like I explained earlier as well, something called torch, like the viruses, toxoplasma, rubella, cytomegalovirus, and herpes. I want to run and something called parvovirus as well. You want to check all that and make sure they don't have that. Now, if you've done all your tests and the person doesn't have any of that and it just isolated excess water, the main disadvantage or the main risk, there's no disadvantage, the main risk is that now remember that excess water, okay, let me also explain it. I like using analogy a lot. Okay, so just imagine you're in a swimming pool. If you have excess water in a swimming pool, you can remember that you'll just be floating everywhere. But if the water in that swimming pool is reduced to the minimum, you're just going to either be on the floor. You have water there, but you're on the floor, but you can't move anywhere. It's the same with excess water with babies. So when you have excess water, it can cause the head not to engage early. So the baby is just breech today, head tomorrow, transfer, just rotating. The risk with that is that if your water break, instead of the baby coming first, the cord, so there's something called cord prolapse. The cord, that's the attachment between the placenta and the baby, can come first. And that can be dangerous. So if you have excess water, what I do is when it comes to the time that the person is about to get delivered, when they get to about 38 weeks, I offer them induction. I say, you know what, we can induce you in a hospital where we know that your water is going to break, you're in the hospital, because cord prolapse is very dangerous. If it happens while you're at home, before you get to the hospital, the baby, you might not be able to keep the baby. So those are the situations with excess water. So you have to look at the risk. It might not let your baby engage quickly or early or not at all. There's a risk of cord prolapse if your bag ruptures in labor when you're at home. If it ruptures in the hospital and somebody picks the cord, it's fine. It's an emergency cesarean section. But if it does that at home, it can be an unpleasant situation. Now, having said that, some people will have excess water but their baby will still engage properly. So I think it's a discussion between you and your doctor, scan you, monitor you, and then make a decision. But you also have to ask the question as well, what are my risks? How does this affect my baby? And stuff like that. All right.
Thank you. Thank you. And when I can see some questions are repetitive because someone, for example, is saying does location of a fibroid. We've already addressed that on this
Yeah,
call.
yeah. The
Last
answer
week,
is yes. Yeah.
we've talked about that already, and we also have a recording on just fibroids. So Grace can share that. So we will not address that one here. So let's concentrate on. So this question on is third trimester miscarriage possible? We've addressed that as well.
Yeah,
So
I
I'm
mean, third trimester is not a miscarriage, okay? That will be a
maybe
preterm
let's
delivery. It will be a preterm delivery, okay? You
yeah, so
don't
let's
miscarry in third trimester. The baby is already able to leave. So that would just be a preterm delivery, and that baby should leave, okay?
okay. So this one says should a scenario of bleeding after sex in first trimester or any child should it be a cause for concern?
Well, so the first thing, if somebody tells me that they're bleeding after sex, it will be a cause for concern for me because the first thing is that I want to look at the cervix. So it means that the cervix, it means that anything touches it is bleeding. So I want to look at it and make sure that there's no abnormality on the cervix. For example, is this person, are they up to date with their pap smear? So pap smear is the cancer prevention test. So you want to make sure there's nothing abnormal on their cervix. Also, you might be able to reassure them as well. After they've done a pap smear and it's normal, you want to look at the cervix. And so there's some hormonal changes that goes on with the cervix when you're pregnant. So as long as your pap smear is normal, then you can be able to reassure them. And, sometime it will stop, sometime it will keep happening. As you grow, as the pregnancy grows, maybe second trimester, third trimester, if somebody has sex after intercourse, the alarm bell in my head is that I want to know where their placenta is. I want to make sure that the placenta is not low lying. If placenta is low lying, it means that it's close to the cervix, and if anything touches it, it bleeds. In some situation, if your placenta is low lying and you're bleeding, we usually advise the woman not to have sex for now because you don't want them to have like a torrential bleeding if the placenta is low lying. So it's still the same. You want to look around, you want to make sure that everything is fine physically. Why is this bleeding? And then able to reassure them. But you have to look first.
Okay, thank you. So the other questions I have here, I think is something I can answer quickly. I wouldn't really. So this question says, I feel drowsy all the time. Things are cloudy, and I lose sight of things. I've experienced a miscarriage before. I mean, should she be worried about the drowsiness, considering that she has had a miscarriage before?
Um, well, I think if you're pregnant and you feel drowsy, the first thing is to make sure that you're not anemic.
Okay.
I think you need to go to your doctor or your GP and find out whether you're anemic or not. I lose side of things. But pregnancy changes a lot of things in different people. So, but because you've had a miscarriage, I would just say, well, I think it's not normal to feel drowsy all the time unless you're vomiting. But it would be nice I mean, it's not as if the person is in the UK. Should I be worried about how I feel or should visit my GP early? I think there's nothing wrong in visiting your GP early, whether you're going to get an appointment, because the UK situation is a bit difficult now. But I think, yeah, you need to get somebody to look at you so that you don't look back and say, oh, if I had known. I experienced a miscarriage in 2020 and led to DNC. I wouldn't be meeting. Well, the good thing is that you're pregnant now. So the first thing is just assume that everything is okay. But from the drowsiness, I will feel that you need to go and have that checked.
And for mamas, please, we always recommend once you are pregnant, you have to take this issue of anemia very seriously. So we have lots of recommendations that we've shared. So you don't need to wait until they check and they realize that you're anemic. You should constantly, because you can even have a good PCV in the first trimester, and by third trimester, yeah. So you need to constantly be on that. Grace can share recommendations on the group so that we can move quickly. This one says, can exposure to radiation cause a miscarriage?
Well, I need to know the context of the radiation because what do they mean radiation? And if they're working in a place where they're exposed to radiation, what kind of protection are they using? So I think if the person can tell me what they mean by radiation, then it will be easier to answer that.
Okay.
Um,
Okay, so I'm going to move forward. Say, is it okay to walk out after the first
yes,
trimester?
it's okay to work out throughout the pregnancy.
Yeah, and also depends on your pre-pregnancy. Because Dr. Labi, some of them come and they say that because they are gaining weight, they want to lift 10 kg weight,
No,
and
no,
before
no, no,
pregnancy, they
no,
had
no.
never
If
lifted
you're
1 kg weight.
no, so the main thing is that you can maintain your pre-pregnancy status. If you're an athlete, pre-pregnancy, continue with it. You can run throughout the pregnancy. If you're a fitness guru and your pregnancy does not stop you from doing that. But yes, if you've never done it before and suddenly you want to be trying to lift weight, please, I think just be since you're not, and it's the same with somebody who is not a fitness person as well, and suddenly you want to do fit, you want to be carrying weight up and down. Everything is moderation and be sensible. That's the main thing.
Thank you. Those are key words. Some even go as far as saying they want to embark on a weight loss program. Those are
In
all very
pregnancy,
funny.
no, you
It's quite
shouldn't do that.
shocking.
No, you shouldn't do that in pregnancy. So just you will lose all the weight, or you can do the weight loss program after. There's a question I haven't addressed here, which is, please, doctor, can I get my baby monitored even if my baby is moving? Yeah, I mean, if you need to you need to be careful as well so that anxiety doesn't take over the pleasure of being pregnant. Because you need to enjoy pregnancy as well, but you shouldn't be anxious about it all the time because that has its own implication as well. But yeah, you can discuss with your obstetrician and say, you know what? I mean, for example, in my facility, we have different package. We have people that, you know what? I'm happy. I just want to come 2 or 3 times or 4 times in this pregnancy. That's me. If I feel that I need more, I will come. But we also have people that either high risk or they want to be monitored a lot. They come under, but and the payment is very different as well. So I think you can definitely speak with the obstetrician. Okay, I work in a cath lab. Yeah, so you work in a cath lab. That means you use the shield. Yeah, you will exactly. You use the lead apron. I left in my nice. So you're fine. You don't have any problem with it at all.
I
So
think the only question left here, because like I said, I think we've addressed this fibroid location discussion. I think the only two questions I can see that's outstanding here will just be cramps in second trimester
yeah.
and infection. I think that'll be all.
So I still have cramps in my second trimester. So the issue with that is that I want to believe that somebody would have scanned you and see whether there's anything. I think sometimes people with fibroid keeps having cramps for a long time. And like I explained as well, if you keep having cramps, maybe your doctor might want to prescribe progesterone for you, which is like it keeps the womb a bit quiet and relaxed. Maybe your doctor might want to look at that, but sometimes you won't find any reason, but this person will continue to have cramps. It just um it's kind of discomfort and also the fact that it gives you a lot of anxiety. Why am I having cramps? But a lot of the time, some people even have like mild cramps up to when they deliver, and it doesn't cause any problem to them at all. So
Okay.
please speak with your doctor. Let them check you. Let them make sure there's nothing causing cramps. Make sure that you don't have UTI, like urinary infection, fibroid, and then if none, maybe they want to start you on progesterone to see whether this will help you. The discharge one,
Yeah, final question.
I have treated infection when I was 5 weeks, but I noticed that my discharge is a little yellow. What should I do? Now, the first thing is that the commonest discharge in pregnancy, well, sorry, let me rephrase that. Discharge is very common and normal in pregnancy, increased discharge, very common and normal. But sometimes you can have a bit more thrush than normal, okay? So some people will have thrush more than normal, and if they have that, it means that and then sometimes you treat it, but it comes back. So I think it's important that you have a proper check. If you have discharge, either go to your hospital or go to a very good lab, or not any random lab, because I will be honest with you, labs in Nigeria or Lagos, they can run you mad. They can tell you things that are not there. They can tell you things that are not there. So go to a proper lab and then have your test done, or just stay with your doctor and have it done. So before they start seeing staph aureus, staph this, staph that, and you're using antibiotics all the time, and it's not clearing. So my take is that just be careful. A lot of the time, there's nothing wrong. It's just normal discharge, and it's just excessive of it because you're pregnant. All right. So please have it checked by your hospital. Make sure that, and if it's thrush, some people just have recurrent thrush, and thrush all you need to do. And sometime as well, you got to think about it. If they say you have an infection and you use antibiotics, antibiotics can bring thrush. So it becomes a cycle. You go to a lab, they say, you have staph aureus. You use antibiotics, it gives you thrush. The discharge comes, it's initially white, it becomes yellow, green, and then infection sets in. You do another swab, so it becomes a cycle, really. So that's why I said that the person that does your swab and the lab that does it is very important.
All right. Thank you so much, Dr. Alabi. I mean, that'll be all the questions that we can take. I think we'll just get your final words rather. What are your final thoughts to women who have experienced miscarriages or baby loss before? And I think one key thing to know, Dr. Alabi, is that a lot of women that have had this before always have anxiety. It's such a major issue. What would be your parting words to them?
Well, I think the first thing is that for people like you that are supporting and getting information to people, I'll say thank you. Because one of the difference between our society and other Western societies is that there's always a support group. And if you have a support group, because they've gone through what you're going through as well, then it's easier for them to say, don't worry, this happened to me, and next time I was okay. 80-90% of miscarriage happens, and even when you investigate it, you won't find a reason. A lot of them will end up having a normal pregnancy the next time. A small amount of people have a reason for the miscarriage. So it's important that sometime you get investigated. First trimester miscarriage, personally, I don't think you need to. I think what I usually tell people is that some people's miscarriage happen very early before they have pregnancies, and those are the anxious ones. Some people have their miscarriage, they've had a child or two, and then have a miscarriage. Because their body have had two babies, those are not necessarily as anxious as the first group, because they know that, my body is fine. So usually they wait and just have another one. So a lot of the time, you're not alone. Miscarriage is very common, and there's nothing wrong with your baby. There's nothing wrong with your body as well. So you will end up having a normal pregnancy the next time. You need to work with a facility that you have a connection with the doctor and the nurses, not only the doctor. You have to make sure that they have a pedigree. You have to make sure that, and also get a lot of information as well. I know that unfortunately Google can create a lot more anxiety than not, but look for support group, international or local, that have a pedigree. That pedigree is very important, not just loose cannon talking about a lot of rubbish. Don't listen to social media too much. A lot of nonsense on social media. I think you will hear cases that will scare you when somebody starts telling about their story. But the problem is that they usually just talk about one side of the story. They don't talk about the full story. If you hear the other side of the story, then you will know that it's not necessarily the way it has happened. And people like what's the word to use? Sensationalizing stories. So my take on it is mind your business, look at your pregnancy. I mean, if you're a prayerful person, pray. I know that everybody in Nigeria is praying against their village people and stuff like that. So let's bring that into the picture as well. Pray against your village people, in as much as it's interesting that people that are not in Nigeria don't have village people, but in Nigeria we do have village people. So pray about that as well. But most importantly, just believe that there's nothing going to be wrong with your pregnancy and you'll be fine. Hello?
Thank you,
I'm
thank
done.
you, thank you so much, Dr. Labi. It was such an amazing time. Mamas, please, if you're in the VI axis, they're also in Ikeja actually as well in GRA, so you can check out South Shore Hospital. We've had, in fact, there's a particular mama, Stella. She was. I know she always mentioned baby me go to you as well. So she's a she had a baby as well in South Shore. So you can definitely check out South Shore. We've had lots of testimonies, even mamas that had an IVF and the likes at South Shore Women. Yes. And we can also put the number, we'll share it. Grace, please share the link to the social media pages as well as the website for South Shore for mamas that would also be able to check them out. So Salabi, thank you so much for your time. We're very grateful.
Okay. All right. Have a wonderful weekend, everybody.
Bye.
Bye-bye.